population health is the new buzzword of from 2015 on, and it's going to be the reality that is set in of how we're handling patients moving forward.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
Population health essentially is how we take care for the community, meaning overall better care of diabetes, high blood pressure, pneumonia vaccines, colonoscopy, mammograms, those type of things. That's population health. It's easy to say. Everyone needs to have a colonoscopy. Everyone needs to have a mammogram. But the social determinants of health, what is the education on the need for that? What is the access to transportation to get there? What is the access to actually getting the test done because of a cost issue? Or, is telehealth available when someone doesn't have transport? All of those pieces are part of the social determinants of health. And I think that is probably one of the most important public health issues right now out there. We talk about racism as a public health emergency. That does cause people to not get tests done because of issues. And the cost of payment does not allow people to get tests done. And so that does affect the health of the community. It affects the population's health. And I think that's probably one of the most important issues that I think health systems and health departments need to focus on as we enter into 2021. As health systems get paid and as primary care physicians get paid, there's an old way and a new way, and we're in the middle right now. The old way was you were paid, the more patients you would see, the more payment you would receive, either from Medicare, Medicaid, or private insurance. The future way is you're paid on quality payments based on outcomes. And those outcomes are not just, is your diabetes under control, but did you get your colonoscopy done? How can I help you get your colonoscopy done? How can I help you get better diet and exercise, for example? Right now, we're in the middle. We still have volume payments. And that, in fact, that's the majority of it still. It's maybe 75% of our money still comes from volume. But we do have a small chunk, a quarter or so, and those numbers are off a little bit, of money that comes in for quality payments and outcome payments. And we know that's changing over time. So as primary care physicians, as health systems get paid more for quality and outcomes, they will be investing along with the public health departments and the government in programs and individual patient scenarios that will help them have better outcomes and reduce their social determinant disparities. And I think in the past, telehealth wasn't embraced by doctors, patients, or insurance companies and the government payers. Now it's embraced by all three, at least during this pandemic. So we'll see what the future holds, at least from the insurance company. I think the patients and doctors have gotten over their fear or dislike of it. That's part of what we do now. We're seeing on a given week between 10 and 25% of our patients virtually, which is amazing. It's positive. It really, as we have clinics and schools, as we have vans that go out. Mercy has vans both for dental health, medical health, and mammography that go out to the community. That it just expands access. We have centering pregnancy programs that are out in the communities and primary care offices that are out in the communities. I think that is the key to access. And every person should have a medical home, a primary care doctor, where he or she gets their care by a doctor, a nurse practitioner, a physician assistant. They need to be seen, every single person have a primary care home and then have access. I think there's going to be an increased sense of community, but we don't do that. And businesses play a big part in that as we think through that with their HR practices, encouraging workers to be able to work from home still in the future if that's a possibility for them, or take time off without having penalties. I think that is no matter what, even if it's a common cold or influenza or COVID or whatever it is, I think that is something that the business community has a part in moving forward, both locally and statewide and nationally.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit BusinessJournalDaily.com. For all of your arts and entertainment news, go to AfterHoursYoungstown.com.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.